Hi, you guys.
Hello.
So, for those who do not know me, I think everyone does, but for video purposes, I'm Richelle. I am the owner of Richelle's Wellness, where we have acupuncture, massage, facial, breath work, one-on-ones, and also aura cleansing, life coaching. We have it all. We work in restorative therapy. My presentation today is on self-massage for sinus, inflammation, and pressure, which I think all of us need at this point. Oh, I do need a chair. Is this okay? That's perfect. Yay. Because I'm going to ask for a volunteer at some point. Liz, go ahead. So, the beautiful thing is we can go ahead and have some relief from this kind of torture we're going through right now with the environment. Everyone is experiencing allergies that normally would never experience allergies, and they're lasting so much longer. So, as much as I would recommend come see us for a really good deep cleanse, this is a way for you to maintain yourself. As you can see from the diagram, we have numerous things going on underneath here. We have muscle, we have fascia, we have lymph nodes. So these green little dots right here, those are lymph nodes. And there's tons of them, all throughout your face, your neck, your scalp, all the way down into your body. It is the final cleansing system. Actually, I'm gonna wait a little bit.
Okay.
So. This way people can see the diagram.
Yeah. Oh, yeah. My was in the way.
So that is the final cleansing system for our body. It is the last resort. It actually cleanses our blood system and it extracts all the last little bits. Unfortunately, because we have so many in our face, because of allergens and other infections we might get, it gets really stuffy up in there. So, you might be able to see there's all these green lines that are right there. It actually goes right next to your circulatory system. So, if you ever see a circulatory system, your blood flow or anything along those lines, you'll know where the lymphatic system is. The lymphatic system is also very surface level, and that's what we're primarily going to be draining today. So always keep that in mind. It's very surface. So you want to do lighter pressure. You never want to do huge deep dives in there because then you can actually bruise yourself and you can cause more damage than good. No one has to be as deep as me. So our whole goal is to relax the muscular system and relax the lymph and drain the lymph to go down towards your heart. You always want your lymph to go towards your heart. Just a good note right there. So, now we can start. So what I would recommend is doing this when you're on the bed or in a prop position or in a recliner. That way you're not holding your hands up like this for an extended period of time. You'll actually want to do it longer. Would you mind taking your hair out?
Oh, take this up, off?
Yes, please. Sure. So, there, that's good. So, the beautiful thing is, I keep saying that. What we want to do is actually start from the back and work our way up and around. Because it's not just the front of our face that is affected, it's also the back of our skull. We have muscle and tissue all the way back here as well. So what you're going to want to do is use these 3 fingers right here, or your thumb. If you have really strong thumbs, you can actually put that right into the base of your skull, like right in there. And you're going to go ahead and just massage that. Clockwise, counterclockwise, whichever feels best for you. And it should be this little divot that you have right underneath the skull. Do you all feel it?
Yeah.
Mm-hmm. Perfect. And it feels good, huh?
Yeah.
That's your suboccipitals. I'm going to do it for you.
Okay.
So your suboccipitals, you're going to go ahead and give those a really nice, gentle massage. Am I too hard?
No, it feels
Hey,
great.
up or down, does it matter?
I always recommend keeping your head elevated into an actual state. If you go ahead and stretch forward, you might actually cause a little strain on your neck, and we don't want your head to always fall forward because it falls forward enough throughout our lives. So try to keep your head up straight. Then you're going to go ahead and go up your skull. So you're going to come up and around like so. And you're just going to massage your skull. And it's going to feel really, really good. If it doesn't, then keep going. Move different locations. Go to your temporal lobe, which is right in here. Right up in here. How y'all feeling?
Good.
Now, what's really neat is if you take your fingers like so, and you actually push them towards the center, how's that feel?
Good.
Feels good? That's a great pressure relief just for tension release. Releasing your skull muscle, the muscles around your skull, will actually help to release the rest of your sinus flow. It's all connected. So, I'm going to have you tilt your head back slightly from here. You can lean them back. Oh, there we go.
Okay.
So, if you push right here, very gently, but rotate around. That is your temporal lobe. That is really nice. It's a good way to relieve tension as well. Rotate around and reverse rotate. Whatever feels best is probably what you need at this moment. And it's very pointed. It's right in this little groove right here. And that's the neat thing. You can go ahead and find these spots on your own body because they're almost like these little nubs, these little nodules. And those little nubs are where you have tension. FYI, this also helps with wrinkle reduction.
Oh,
Nice.
too late.
That's what I was thinking.
Too late.
So,
Too late.
It's never too late. It's never too late, exactly.
so a good point of reference is you always start in the center and you work your way out. So, throughout the entire face, all the way down, you're going to go ahead and push your fingers, those 3 fingers I was talking about, right into your forehead. Massage it and then push out. With pressure, push it down. Feels good, huh? And go down. Very good. Now the neat thing, see how we're always going down? We're always going away and down. That's key. Next is the eyebrows. Eyebrows are really nice. We hold a lot of tension in our eyebrows. So you're actually going to press on where the hair is. So you're going to press into where the hair is, but you're going to feel these little nubs. You're going to feel these little hard spots along your eyebrows. Does everyone feel them?
No.
Let me go ahead and try it on everyone. Hold right there, sweetie. You want me to? Can I touch you? Sure.
Yes.
Right there. Do you feel that? Hurts?
Yeah.
It feels good, but it hurts? Yeah. So right there. So when you go across and you have that one spot, you're like, oh, okay. That is what you're going for. Anybody else want a hand? And there is a little nub right there.
Nub?
So you'll feel like a little bump. A little bump. Where's your adult?
How many nubs?
Sarah?
I'll be right back.
Okay.
Is it okay if I touch her? Okay. Right there. Feels good? So that's what you're looking for. Yours are smaller because you're young. And then you have some right up there too. So go ahead and feel for those. Oh, yours are right there. Right there. Right there. And right there. They hurt a little, huh?
Feel a bump?
Mm-hmm. Do they hurt a
There's
little?
pressure, yeah?
Yeah. And right there. It's even a little more right there.
The first one, I don't want to feel it.
Right.
I don't feel it when I come.
Go ahead and press. And actually use these fingers. Use your middle fingers.
These two?
Use this one.
This one.
Don't flip me off now. Go ahead and just rub across your, where does it hurt? Press hard. It's okay. So right here, go ahead and press right here.
Right here?
Yep. Press nice and hard. Pointed.
Oh, yeah. Wow. It kind of sinks to the top of your head.
And then press in. Hi.
Hi.
Right there.
Yeah.
So yours are almost right over your eyeballs. So go ahead and press and feel. Hi, darling.
He's getting special treatment.
He always does. He loves me. Right there, baby. And right there as well. Anyone else?
Thank you, Keith.
Yes, thank you, Keith.
It's okay.
First I thought it was because I sit down like that.
You don't have very many, that's why. Right there. Yours are more on the outside. You feel that right there? Okay. You good?
I'm good.
Okay. All right. So that little spot right there, that actually is a tension holder. And you also have glands that run, or you have lymphs that actually run through there. So when you're pressing in on those, you're also going to push down eventually too, because you're going to, again, drain down towards your heart. Follow the curve of your face, follow the bone. Also, a lot of people, they'll go ahead and get tension right under their eyebrow as well. You might actually feel it more in there. You can even go into near your nose. Right into that crest right there. Let me show you. Right in there, you guys. And push in towards your nose, and that should give you a good release. And this is under your eyebrows. That's on your lid of your eye. Any questions? Awesome. So this is all in the process, and everyone is going to feel it in different locations because we all hold tension in different spots. Next, what we're going to do is we're going to do the cheeks. So your cheekbones, right by your nose, you're just going to press it in. And you should feel good pressure. And then drain it down. Follow your cheekbones. Drain it down towards your jaw and follow your cheekbones, right underneath. Anyone need any help? Go ahead. Excellent.
Richelle, what time of day do you recommend doing this?
Truthfully, whenever you feel the pressure. It's very good first thing in the morning when you're putting on your morning oil. I recommend doing this, then applying your oil though. You want traction. You want to have a little traction because that's going to give you better movement along your face. And it's really good for revitalizing your skin as well, right, Kristen?
Absolutely.
Do you sell facial oil?
Yes, we do. We have a whole skincare normal line, so, which is for sale featuring Maida. It's all natural. Which we use in our facials as well. Awesome. So, what we're going to do next is we're going to do the jaw, which is a hot spot for a lot of people. Now remember, you do not want to dig in too deep into those cheeks. Not into the little grooves right here. You see where I am and where it's right on the bone, right on the joint. You do not want to dig in too deep there because you have a lot of nerves in there, and trust me, you do not want to hit them. You won't like me. Okay, so what you're going to do though is you're going to gently push down and push down. And then you're gonna work your way around the jawline to when you're underneath the jaw, like right under here. Right, like that. Again, gentle. And you just go down the throat. Again, you're following towards the heart. You're draining your face down to your heart. How's that feeling so far?
Awesome.
Okay. So, another wonderful little trick is follow your jawbone, your mandible, right like so. One finger underneath. I'm going to tilt your head up like this. One finger underneath like so. One on top. Good one is the thumb. Oh, it's a little difficult for me.
Yeah.
So you want the pointer on top, your thumb underneath. Go into the center, like so, and stretch back. Give yourself a facelift. So you have a massive amount of lymph nodes that are right under your jawline. And then that goes down into your throat. And again, massage down your throat. Feel everything go down. You'll probably notice you're swallowing a lot. That is a good sign. That means you're actually draining. You're actually flushing your system. All right. Any questions? I know it's short. I'm trying to save this time.
What about like the back?
The back of the neck, you can self-massage. I would recommend laying on your bed and tucking your fingers under like so.
Okay.
And then go away from the spine. So what you're going to be doing is pushing it away from the spine.
With your knuckles.
With your knuckles. I would recommend your knuckles. And it should fit really good around in that groove kind of situation. You can do your fingers as well, but your fingers are going to get really tired if you're not used to massaging. So, yes, Molly?
So sometimes in yoga, we'll do a light palpation with the pads
Yes.
of the finger. Does that
Yes.
do similar? I mean, clearly it's not as deep, but we'll just do little light
Yep.
tapping.
This is also really good just to stimulate your face, get everything going first thing in the morning.
Yeah.
It's a great, great start. Then I would recommend doing a full drain.
Okay.
Also, I know a little trick for your tongue. So a lot of people have, I'm going to do this and then we'll close so that way you can set up, Lorna.
Okay.
Where was I going? Oh,
Tongue.
tongue. Thank you. If you'd like, you can.
Oh, thank you.
Thank you. Thank you. Thank you. Thank her for getting a Richelle massage.
Yeah, that was awesome.
With your tongue, a lot of people, they'll get really tight jaws. They'll clench their teeth, they have to wear mouth guards, they grind their teeth. This might also help with snoring a little bit, and also help with this. So it's a little trick. I learned watching Tai Chi. What you're going to do is you're going to exercise your tongue. So you're going to stick your tongue out through your teeth, but keep your lips closed. Like so. What you're going to do then is you're going to actually take your tongue and move it around your gum line. Lips closed. So in between your lips and your teeth. So you're going to brush your teeth with your tongue. And move it as far as it will go, all the way around. Take your time. Feel every groove of your tooth.
And what is that good for?
It actually helps with releasing tension in your jaw because you're exercising your tongue. You're exercising
my
it.
neck too.
Oh.
Yeah.
Nice. Well, if you think about it, your tongue goes all the way back.
Yeah.
So it's a really, really good exercise. Go the opposite direction. Do it until your tongue's like, And you'll get saliva as well. And take your time swallowing that. It's a good way to also self-meditate, calm yourself. It's a great way to release tension and get back into your center. And possibly stop snoring, which I know Mitch will appreciate it. Any questions? Oh, yes.
How often during the week should we be doing this whole massage thing?
Oh, the
Wait.
facial massage?
Well, yeah, well, you know.
When you feel like you need it. At least, I mean, during allergy season, at least once or twice a day, drain your face, get the pollen out of your system, get the inflammation, because that's what's happening, is your body is fighting the pollen and the allergen, and it's creating inflammation in your sinus cavity. So we're just trying to get all of it out so we do not get an infection, which none of us want. Any other questions? Beautiful. Thank you.